I'm here with Dr. Gemmy Cheung of Singapore National Eye Center, and Dr. Cheung is a retinal specialist. In particular, I would consider her to be a woman superhero of ophthalmology, which goes very well with our superhero segment in Pi magazine, honoring the heroes of ophthalmology. In particular, it's true that the issues of women in ophthalmology are very important, and there are many female heroes out there in our field. Thanks so much for joining us today to talk about those issues.
You're welcome. It's my pleasure.
So let me just start by saying, as a woman in ophthalmology, what are some of the gender-specific challenges that you have faced over the years?
Sure. I think struggling with time and prioritization of your life is actually not a gender-specific challenge. It's a challenge for all of us, but for many women, we have family to look after, especially devoting time to actually having children, maternity leave, and catching up with your studies during that stage of life. Many younger residents face that, and throughout your subsequent career to balance life, looking after children who have schoolwork, and also your own career. And so that is a major challenge, I think.
That's very interesting. Well, and that's an important point too, time.
Yes.
So in the world, it seems like the issue of time can be much more challenging for a woman ophthalmologist than a man.
Yes, I suppose it shouldn't be, or you could say, but traditionally, I think in many parts of the world, maybe more so in the eastern part of the world, also the responsibility of looking after children often falls a little bit more heavy on the women. And probably also sentimentally, women tend to feel much more involved. And I know many friends, and sometimes myself, when we are kind of torn between whether to stay behind for work meetings, or whether to go home earlier, look after the kids at home, there is this emotional struggle and sometimes a sense of guilt of whether to further your career or whether to call it at some point and say, okay, this is family time.
Right. So there were times when I don't know, correct me if I'm wrong, but you might have to wake up very early, drop children off at school, and then continue on to a completely different life in ophthalmology.
Yes.
I can see how that's really a superhero task to perform.
I have to say, to be fair, many of my male colleagues also do that, but maybe women also have to worry about that a little bit more.
Sure. Great. Well, and Gemmy, how do you imagine that being a female doctor is different from being a woman in other professions? Do you think it's even more taxing in some ways?
Well, I'm just imagining that because I wouldn't have had any experience in other fields. Perhaps actually medicine is quite a friendly field for women, especially ophthalmology. Perhaps there is some stereotyping compared to, for example, orthopedic. So the work requirements are different for those jobs. Comparing outside medicine, for example, in the banking field, for example, I could imagine women in those fields will be facing different kinds of challenges. But overall, I think ophthalmology is actually quite a friendly field for women. Yeah,
that's great to know. Now, to ask maybe a more controversial question, is there a glass ceiling in ophthalmology?
I think it depends on where you are.
Yes.
And I would say from my own personal experience, I haven't encountered that. But probably it's also related to how much one is willing to invest in the career. Often it may not be a real glass ceiling, but many women, when you've achieved a certain point of career, we will say we'll step back, that is enough, and then compared to, for example, if you are the medical director or the CEO, often really there is a lot more requirement or maybe personal sacrifice in terms of time with the family. So sometimes it's by choice, not by a real glass ceiling.
Right. Well, currently in popular culture, there's this, Pound Me Too movement has taken aim at sexual aggression in other industries, in Hollywood, for example. Now, our industry in ophthalmology is much more, I would say it has a level of professionalism that other industries do not. But do you think that there are certain movements around the world like this that have to do with gender equality that also helps to set ophthalmology on a new level in terms of equality itself?
That is a very sensitive issue at the moment, but yes, I think I think that just is applicable to all fields in life. It's not specific, but it's also, I don't think it's personally, I haven't experienced anything, I'm very fortunate like that, but the awareness of such issues is very important.
Yeah. Now, given interactions that you may have had with the other side of the planet, how do you think issues for women in ophthalmology might differ in Asia Pacific versus back in America or in Europe? Do you think that there are differences?
Definitely.
Yeah.
I mean, the cultural background is very different. Expectations from personal and also from friends and family of the role of woman is also very different between different parts of the world. So I think we've covered some of that earlier on. Expectation of how much of looking after the family, a woman, or your division between a woman and a man probably is different. And overall, I would think it's a bit of generalization, but probably women from the Eastern culture tend to be also more reserved, and again, they would feel that certain things are more acceptable, and they don't think that it offends them so much, rightly or wrongly, compared to people from the West.
And I wonder, talking about the glass ceiling a little bit more, I wonder if that could affect an issue like salary negotiation, for example, where one might, East or West, in terms of negotiation, really, be a bit, if not aggressive, very confident in accepting or making an offer to a company. Perhaps that's a little bit more challenging in Asia than the West.
Yes, I think that is a very individual issue between individuals, and it can vary between different organizations as well. So, but as you mentioned, now that we are more aware of these issues, so in a way it is good for us that there have been movements in other parts of the world that have brought these issues to light. Then hopefully women in ophthalmology all around the world, but also in this part of the world, will also speak up for their right. Yes.
Indeed. Now, as a group, APAO, or Ophthalmic World Leaders, formerly known as Ophthalmology or Ophthalmic Women Leaders, often have said that men also play an important part as a solution for gender equality.
Definitely.
Would you agree with that?
Definitely.
Now, do you think men and women practice ophthalmology differently, whether surgically or whether it relates to bedside manner? Tell me more about that.
I think with every aspect of life, there are the hard side and the soft side, and there's definitely some differences between men and women. I think overall, there's a bit of generalization. Men tend to be a little bit more decisive. Women tend to think about many aspects before we act. And a lot of us say women talk less and deliver more.
Well, that's a great vote of confidence. I haven't been in the surgical operating room in that type of scenario, so I will withhold comment for the moment. But when you're talking about also dealing with patients, patient engagement.
Yes.
Sometimes where I come from, there isn't a lot of time for patients, and are women a little bit more accommodating in spending time with patients and explaining options differently than men do?
Again, there's a bit of generalization. I think women tend to observe the unspoken emotions, and they may be a bit more sensitive to sense that a patient may be a bit worried about some aspects or feeling anxious. So, but that is definitely something that we teach in medical school, irrespective of students' gender, to observe these things. So, but there are some advantages. Of course, there are some disadvantages as well. Yeah.
Okay, great. Now, we'll just have a couple more questions here. Are there particular companies or products that are somehow supportive to women's efforts in ophthalmology? I mean, I guess all products do great things for patients in one way or another, but Are there companies out there that really support women in ophthalmology?
I'm not aware of any particular preference to this, but overall, I think with any such, for example, charity or philanthropy, I think each company have their criteria for assessing the priorities and how it may align to their visions and missions.
Right. Well, Johnson & Johnson has graciously decided to sponsor our segment, so I guess we can applaud them for that. Now, are there any helpful local, regional, or global societies to support women in ophthalmology from your viewpoint?
So we are here in APAO, and we have several segments from us particularly supporting women in ophthalmology. So that is a good start, and definitely very helpful for us to have a forum to talk to each other and explore some issues. I believe AAO also has this. So probably if we propagate that to individual region or country's own college, maybe form focus groups, at least as a support network, first of all, informally, and then we can from that we can organize more specific forums.
Great. Well, hopefully this is a start toward that initiative.
Yes. And thank Pi for covering women in ophthalmology.
Oh, well, thank you, Dr. Cheung. Well, we certainly appreciate your sitting here with us in Hong Kong, and we'll see you out there in the eye care universe.
My pleasure. Thank you very much.
Thank you.